Hello everybody, it's been a little while since we've had a live Q&A, so thank you so much for joining to find out what's kind of the snippets of information that we have at the moment. We haven't got a huge amount to say, but importantly, we've got some very significant things just to share. Now tonight I've got Dr. Miller-Craig with me, so at this point I'm going to ask Helen to transfer the camera over to Dr. Miller-Craig so he can give us a wave.
Hi there, everyone.
So you get to see his lovely face, and we'll carry on with today. So next slide, Helen. Again, I just put this slide in generally, as you know, for every meeting in terms of what we're going to be talking about. So the first thing is COVID-19 again. We are now in phase 10. Which is huge. So we have done 10 rounds of vaccinations once we finish this lot, through to some service changes that are coming into effect tomorrow, and an update on our access and communication. Remember, please ask questions. So if I just recap on how the live event works, Helen will move over to the next screen. And so we have it here. So we've got the live event. Ask questions at any point using the chat. We'll make sure that we get to all of them, and if there are any others that we don't cover and they're important to you, please share. If we can answer them tonight, you know that we will. If we can't, then we'll definitely come back. So yeah, we'll keep an eye on the chat, and we'll make sure we answer all the questions. Please kind of like questions if there's something that you want to ask, rather than ask the same question over and over. It just helps make sure that we identify the most important and prioritize accordingly. So next slide, please, Helen. And you can move on again, because we're talking about COVID-19. So come Wednesday, we start our vaccination programme again for this spring. As it has been in other years, it's the same cohort of people from last spring. So if you were invited last year, last April, May time, to have your COVID vaccine, you're going to be asked to attend again. Hopefully you already have an appointment booked, but if not, please contact us and we will book it for you. We have sent invitations out by email, by text message, and we've also been phoning people as well. It's just the phoning takes a lot longer. So if you can come to us, that would be great. So as we know, it's adults aged over 75 or turning 75 from the 30th of June 2025. So those of you who are lucky to have a birthday before 30th of June, turning 75, then of course you can come and have your vaccine with us. All patients with immunosuppression are again being invited, but you've always got to make sure that you haven't had a booster in the last 91 days. It's probably unlikely, but it could happen, and I just want to make that clear to you all. The vaccine is Spikevax, which is the same vaccine as the last spring one, not the same as your winter one that you've had, but it is the same as last time of the Spikevax in the spring phase 8 that we had. Okay, so we've got the side effects here, and I just wondered whether I could hand over to Dr. Miller-Craig here to just talk through those side effects. Of course, we know them quite well, but it stops you having to listen to my voice for the full half an hour. So over to Ed.
Thank you, Anna. So the commonest side effects, as with many vaccines, is having some soreness around the site of the immunisation, heavy feeling or tenderness. That can last up to a couple of days. The other common side effects with COVID vaccines are tiredness, sometimes headaches and mild flu-like symptoms, sometimes muscle aches for a couple of days as well.
Great. Thanks, Ed, much appreciated. So I'm just going to have a quick look in the chat and see if anybody's mentioned anything about COVID and what we've said so far. Okay, so nobody's got any questions, but please do ask as we talk. So if we can move on to the next screen. What we've got here is your part 2. So what we're doing, as I said, our vaccines start on Wednesday, and at the moment we've got appointments booked up to the 14th of April. We're trying to consolidate our campaign, as we always do, to make sure that we can optimise your immunity as a community, but also in terms of keeping the rest of our services going, as well as we can, and optimally during this vaccination period. And I've already talked to you about the fact that we're inviting out. Now there's 509 patients booked in so far, and there's 589 to go. So please, if you can book those appointments up, that would be great. Our vaccine that we've had delivered expires on the 22nd of April. So it's really important that we try to vaccinate up to the 14th of April for you to get seen. We want that in a few days before Easter. So please do have your vaccine in this period of 2nd of April to the 14th of April, so that if you do have any side effects, you're completely clear for Easter by then, and you're not leading into the next lot of bank holidays, etc., that are coming. So please do book your vaccination with us. It's a very quick appointment, and you can come to Uphaven or Durrington. So the last thing that I know sometimes, well, I've been asked previously, is of course we've got the new vaccine, RSV, and it is specifically for pretty much the same cohort, roughly here. Now, we cannot give RSV at the same time as COVID-19. It has to be a separate appointment. So whilst you're with us, if you are eligible for an RSV vaccination, please book it with us on your way out. We have appointments every week for that vaccination. Okay, so moving on to the last screen. We've got any questions about COVID-19? So even if I move on to the next subject, in terms of that, please do ask questions. We've got Dr. Miller-Craig here, so I know we can't do direct one-to-ones, and I wouldn't ask you to share information with us, but if you can give us your details afterwards, then that would be great. So we've got a question from Sam. Thank you, Sam, much appreciated. I'm going to ask the question, and then Dr. Miller-Craig is going to answer it. So Dr. Miller-Craig, Sam asks, I know they like to alternate arms, but does it matter if it's the same arm?
So I presume, Sam, you mean using the same arm as you last had the COVID vaccine in? And no, it doesn't matter. That's absolutely fine.
Okay, so I'm going to just publish that question so that everybody can see that Sam asked that, which is great. Always like a question, as you know. Any other questions? So I'm just going to then move on to the next topic for this evening, because it might be a little bit more meaty. It's very much clinically focused in terms of that, and it's a few service changes that we've got, whereby what we call the ICB, so the Integrated Care Board, have made a few decisions about kind of what happens about particular funding and particular pathways for patients who live in Baines, Swindon and Wiltshire. And of course, Avon Valley practice is based in Wiltshire, so they're going to affect perhaps you. So let's move on to the next slide so we can go through them. So what I'll do is I'll talk about each one in turn, and then if you've got any questions, that's when we'll look to invite Dr. Miller-Craig in to perhaps be able to answer them if we can. If we can't answer your question, then please we'll take it forward and we'll raise it with the ICB directly to be able to get an answer for you. So the first one is about bariatric surgery. So of course, that's not something that you have done at Avon Valley practice. You always go to a hospital for bariatric surgery. Oh, hang on, Helen, you've moved the screen. Sorry, everybody. Can you go back, Helen? Yeah, lovely. Okay, sorry about that. We're just testing you. So bariatric surgery. After you've had bariatric surgery, there's a 2-year follow-up. Now, if you have that within the NHS, so you have your bariatric surgery in an NHS hospital in England, then your follow-up care will be under secondary care. So you need to go back to your hospital, and that includes B12 injections. There's been over recent times, more patients coming to the GP surgery for follow-up, including the B12 injections, to be able to do that. However, how the funding works and the clinical responsibility that's encompassed with bariatric surgery means that it's really important that those patients who have had bariatric surgery and are under follow-up for the 2 years post-surgery go to the hospital where they had their surgery to be able to get the follow-up care they need. They shouldn't be coming to Avon Valley practice for that, or any other GP practice in Wiltshire, Baines or Swindon. Meanwhile, we do know there's an increasing number of people that are having bariatric surgery privately to be able to do that, and there are set arrangements in place for people that have bariatric surgery privately, and that includes going abroad. The details are being worked up and made kind of more patient friendly, I think, in terms of their terminology. So I direct you to the BSW, so that's Baines, Swindon and Wiltshire ICB website. That's the integrated care website. So if you can take a look at that, if that applies to you, then that should explain what to do if you've had private bariatric surgery, because the follow-up care does not come within the NHS remit. The follow-up should be paid for within the private payment of the bariatric surgery in the first place. So that's one change for everybody, to be able to do that. So Sam's asked, I've had B12 jabs at the surgery for years, surgery in 2008. Okay, so if you can, without sharing any further details, Sam, in terms of that, because I don't want to breach any confidentiality, please can you share your details with us and we'll follow up directly and get you an answer on that, okay, to be clear on what happens, because of course you're outside of the 2-year parameter and what's required, so there might be a different arrangement, but thank you for reaching out. Any other questions? Okay, so that's about bariatric surgery. Moving on then, we have assessment and treatment of minor injuries. So minor injuries can go from the very simple to the very complex, where you might need x-rays, etc., CT scans, MRI scans. But you also get it very baseline that, you know, you've fallen over in the garden and you need kind of patching up of some sort. To be clear, the Integrated Care Board, so the ICB, have, you know, declared that really minor injuries should not be being treated for in GP practices, and therefore they should be being signposted to the local minor injuries unit or A&E. So for those of you at Avon Valley practice, I think realistically the closest minor injury unit is Andover. So that would be where you'll be required to go. Alternatively, you can go to A&E in Salisbury, but I think Andover is probably closest for most people, has all the facilities of X-ray, CT scans, etc., available to you for any minor injuries that you have to do that. Okay. We've then got vivisection. So vivisection is, some people think that that's blood tests. It's not. Vivisection is whereby a litre of blood is withdrawn from somebody due to the hematological disorders that one may have. Now, rather than go to the hospital, for many years, Avon Valley Practice has provided that service to only a few, I think actually 5 people in total currently. We provide that service to them at the surgery to prevent any kind of unnecessary driving to and from the hospital to have that blood removed. Unfortunately, that service is no longer continuing. We're working with Baines, Swindon and Wiltshire ICB to find out what to do with the 5 patients, as in who's to contact. We understand it should be haematology, but we will look to contact direct after this meeting, well, in this week, after this meeting, so that we can just explain that they'll need to go back to the hospital to get that done from now on. to be able to do that. So I'm sorry, that's quite significant for those 5 patients. I understand that, and I'm really sorry. We would quite happily continue, but indeed it is a service that has been decommissioned from all general practices across Spain, Swindon and Wiltshire. So although I think there were only a handful of us, quite rural practices like we are, it's not something that's continuing from the 1st of April. And the last one is health checks. There's quite specific health checks for patients with severe mental illness. And although we partake in aspects of medication reviews and health checks with people with severe mental illness, they are under the care of the hospital, and all patients requiring the service will need to attend the hospital. I've written a typo. All patients requiring the service will not attend hospital. Actually, they will need to attend hospital. So I'm so sorry about that. It should say will now attend hospital. So they will be contacted by their hospital who they are under the care of, and explain that from now on, then those health checks will be completed at the hospital under their clinical responsibility. So that's quite a lot of kind of information. Now, it's really good that actually there's only 4 things on this list, which I was quite pleased about, to be able to do that. But it's just being really upfront with you about the things that are going on and the changes that are happening that we've been made aware of going into the next financial year. I know that and appreciate there will be other changes, and some of them I don't even realise I know, and others I will be completely flummoxed when they do happen. But I will keep you updated, and that's what Dr. Miller Craig, myself, and the other partners and everybody at Avon Valley Practice tries to do. I haven't had any more questions other than the information from Sam, so please do ask any other questions about any other services as well. Anything you're worried about, anything that you've read, please do share, and we'll be able to do our best to answer those questions this evening. In the meantime, I'll move over to the next section, which is about improving access and communications. So you may have heard in the press about everybody needing, or all general practice must offer online consultations, online access to medical services from the 1st of October 2025. We've been offering a service, it's through System Connect, and I think I've been here before, maybe last September, where we talked about it, and you've got it live if you've got online access through System 1, so your system account, and what's happening in terms of how you go through our website, you can get online access. So that's pretty much already live for all the patients of Avon Valley. It does need improvement. It needs moving forward in terms of that when we find out the detail of the new contractual requirements, but the principles of it are there, and they are there for you to be able to use. So rather than having to phone us for obtaining an appointment, you can use it by contacting us online. It doesn't mean that you book an appointment direct, it's that you tell us kind of the issue, the problem, and then we direct you or book an appointment for you, having triaged it and understand it, to be able to do that. So that's what's been happening about that side of things that you might have heard in the press, hence why I wanted to bring it this evening. We have been working for the last about 6 months now, just over, trying to adapt our phone system to enable people to do everything that we can do online and offer you also on the phones. That includes ordering prescriptions, requesting med 3s without having necessarily to speak to somebody, to try and reduce the number of kind of people that need to speak to a receptionist, just to get through to as many people as possible and give you all choices. So I do think that's really important, that we offer a variety for you all, and we're all in full agreement to that. We've just had some IT hiccups where we felt that we found the solution, and having had months of kind of information governance discussions, ways through frameworks that you have to work with the NHS, we've come across a bit of a difficult situation that we can't proceed with that at the moment until there's some changes to the security of the systems. That's a good thing, in that problems are identified and can be addressed, and that we don't just kind of proceed willy-nilly kind of thing. And you know, we treat your data very seriously and do our utmost to protect it, and therefore we can't proceed with that at the moment. But it's not off the agenda. It's just trying to find something that enables us to achieve that on your behalf, to be able to do it. So please watch this space. We are moving in that direction, and as I find out more from the government updates for October, then we should be able to explore that further. Indeed, while I've been talking about access and communications, we've had a question that says, what if mental are discharging back to GP? I think if you mean if so if secondary care is referring you back to your GP surgery, what happens there? And the issue is, I think the people that with severe mental illness that qualify for this particular type of health check don't usually get completely discharged. They're under the care of the hospital, and that's when they are. If they've been discharged, then that's a different type of service because they've been discharged from the hospital. But those that are under the care of the hospital should have their health checks with the hospital to be able to do that. And so I think hopefully that answers that question in terms of discharging and when people discharge and who cares for somebody. And then another question asked that if you use the NHS app, do we not use, so I was asked to use NHS app, do we not use it anymore? Yes, you can use NHS app. I just forgot to raise it when I said System Connect and System 1 online. You've also got your NHS app as well. Absolutely, you have all those services, they all functioning together, and you should be able to access those services, and they keep getting improved all the time as the IT infrastructure grows and grows. Okay, to be able to do that. Is there any other questions that anybody has? I know I've shared a lot of information in the, well, kind of 25 minutes that we've been on. We've got Dr. Miller Craig here. Any other questions? No? Okay, so I'll just finish on another positive note, and that is that Dr. Shaista Mister is returning to us on the 1st of May. She'll be working 3 days a week, so she'll be joining us from that day on to join the Avon Valley practice. She trained with us, qualified as a GP with us, having been a doctor for many years. So we welcome her back 1st of May to join the group of Dr. Ian Green, Dr. Miller Craig, who you've met this evening, again, Dr. Comber, Dr. Hutchinson and Dr. Dobson. And of course, we also have our trainee doctors with us currently as well. So yeah, welcome to Dr. Shaista Mister, who'll be joining us in May. And at that point, I'll say goodbye. So thank you very much.